we're going through the process of registering with the CAQH platform. This is really important because 2 out of 4 MCOs in the state of Nevada use this to gather information. So what this platform is where you are uploading all the information about you as a doula, and it sits in here, and then you will get a number, a CAQH number, and then MCOs can go in and get information about you without having to email you. So it's actually a great platform. It's kind of a pain to get through. So go ahead and register.
NUCC grouping.
Go ahead and scroll down and see what your other service providers is right there.
Probably provider type not listed.
Yeah, it's provider type not listed. That is correct. And then it's inpatient, outpatient, or outpatient only.
Okay, so this is my home, but should I just put primary practice?
Yes. So you're setting up all your personal information. Yes, all of your address and email and all of that great stuff. Your date. And I put email type both on mine. I would encourage everyone to do that. Click the box that says, I do not have a DEA number. There you go. Click, I do not have a professional license. Continue. We're not a doctor, so we are a certification. Thank you. So you're not done with this yet.
Okay.
You have to check your email, get your, and follow the prompts on the email now. This provider ID right here, where it says provider ID, put that in a note or put that somewhere. You're going to be asked for that in several places where it says provider ID. Yep.
Okay.
Yep. Copy paste your provider ID and put it somewhere where you can access it. And now you're going to continue to create an account. So all you did was created enough information for them to assign you a number. So now you have to fill in everything about yourself. You just start to create an account. I know that some of it's not applicable, like we don't have a DEA number. You can go with your personal to create it.
It's asking for a license number. Okay, I'll start filling this out. We don't have a DEA. No license. Oh, it's not letting me put in.
No, it won't even let you. So just continue. It's just finding you through your. Okay, so now you're creating your the ability to log into this account. So yes, you're going to go through all of the questions, the security stuff. You're going through all of that now.
Congratulations.
Congratulations. Woohoo.
Woo!
Okay, so you can click OK to log in. And then you'll log in. It's like you haven't logged in 3 times already, but that's okay.
I don't know what this is, but
no, that's fine. That's what we did in the beginning.
That's all fine. That's fine. State, suffix, other names, address. It's all in here.
Yep, because you put it in the beginning when you were first setting this up.
Is this for real?
Yeah, it's for real. I know. This is a lot of information and it's a clunky, sort of frustrating process. This is going to be your certification. So it can be the DONA certification. It can be, your wherever you got your birth doula training. You're going to end up putting a lot of them in different places, a lot of certificates and information in. And because we're a certification program, and so for doulas, this is it's not direct. That should be your business license, the NV, whatever it is. This is such a new system for the certification process that things aren't streamlined for us yet, although they use it for non-medical personnel, but you have to kind of do workarounds to get through it.
Active.
And on your license, on your Nevada business license, it will tell you the dates. It should be 2 years. Mine was 2 years. So go ahead, scroll down. I do not prescribe controlled substances. So you can skip that. And then you don't have to do anything with Medicaid. You're adding a Medicaid number. So go ahead and add. The Medicaid number is called a location number. So when you log into the state and you look at your information in the top left, when you log in, it says your provider ID is your NPI and your location ID is actually your Medicaid number. So it'll give like your name, provider ID, and location ID. And it tells you your reevaluation date too. And they're 4 years. So that's good. So add that. You have to add everything before you can move on.
And do I select a reason for not having DEA?
I am not required.
So there's that. That's in there.
That's that. You don't need to do any of this. We don't have any of these. We're not doing medical licensing, future leaders. We don't have any of this. Save and continue. One education record. So push add. For this part, for education, I put in my psychological first aid, my American Red Cross, like you'd put your DONA degree. You put all your certifications in this section. And then under professional training below it, I put in that I went through the Renown Medical Center doula training. You could put like all of your CPR and first aid and certifications here. And then on professional training, you could put doula. I don't know that it makes a big difference. Nobody has asked me to change it or do anything different. You're basically just adding your experience and you'll add all of your certifications.
Okay, so this is not
right, because it's not a professional school. Other not listed to the right. Click the other box to the right, right there. Now you're putting in the information on where you went. Like I put the Red Cross for certification, psychological first aid. You have to look up the addresses on some of these. And
so is this where I would put like DONA for my
and you have to look up all the information. So it's a little time consuming.
Right. Did you
correct? It's under other degree.
Okay. And then you would put this.
You would put what it is, Red Cross or DONA or whatever it is, you add yep.
Okay.
Going. Then under professional training, I put in the Renown Regional Medical Center doula program. Scroll down. Just save and continue, and you can professional training right here. So yeah, I put in the Renown training. If you're not doing Renown training, or let me see, drop down the internship, other training.
Did you put if you did Renown training, did you put internship?
No, I put other training, but then you can find the hospital. And so that's why this goes under professional, where all my other certifications went under educational training.
Personal. Yeah.
Not listed.
Oh, it's letting me get away with that.
Yes, because we just did a doula program through there. I wanted to have this here to show it, and your attendance dates are whatever date you started and whatever date you finished. Usually it's you do the 3.5 hour, that would be your start date. And then you do the 12-hour shift and that would be your end date, or whichever order you do them in.
Obstetrics and gynecology.
Yep. It was just doula co-op program. And I think I put Emily as the name of the director. Yes. And then you save that. So
yes.
that's what I did for professional, and then educational, you're adding, all of your certifications that you've done. So you can go down, you can save and continue.
Have you completed cultural competency training? Yes.
Yep.
Okay. Primary specialty.
You have to click other.
Not listed.
Yep. And then it's our state, but I only added what was required. And then Washoe.
Washoe.
Yep.
Okay.
So
So
go
we're gonna leave
down.
all this alone.
Your certification date is your Nevada certification. You put in the certification date from there.
Does your board certification have an expiration date?
Yes.
Does it have? It does.
It does, because we have to
Oh, look,
recertify.
do you have a secondary specialty?
I put no. If you were a lactation consultant, and you do have certifications, and
Yeah, I can.
so you push yes and then no, unless you're a qualified service provider. Are you trained in CPR? You need to be, so that should be a yes, unless you've gone in advanced. You're not basic life support, advanced cardiac, advanced. You're not a healthcare provider. So when you're scrolling down and looking at all these are all no's, unless you've gone through something really specific that is above and beyond what you would normally do.
Special experience, skills, and training. Did you mark any of these?
I did. I put children in the care of custody of DCF because I have that specifically. Like you just put military. And so you just kind of look through this to see if you have a specific area of expertise, this is a great place to put it. Otherwise, it doesn't really pertain to being a doula.
Please review the missing information.
Of
Oh, there's
course.
gonna be, yeah, there's gonna be all kinds of, wait, why isn't there anything
No, this
here?
is practice locations. This should be, you need to add a location. Because again, think about it from a physician's perspective, right? Where they may have multiple practice locations, or they may have one that's not their mailing address. We are all the same. We are all the things.
It's going in the directory, so it should probably be in here.
Right.
Okay, organization type 2 NPI. This is just my NPI.
It's the business NPI, not your personal NPI.
So I don't have the business NPI.
This is your personal NPI.
Okay, so just mark it doesn't have a type 2.
Yep. You're not virtual only though, so I would change that. Or type of practice. Maybe you showed yours as being, I put other in mine. I clicked open 24 hours on every single day because we really don't have hours. This doesn't really apply to you, so I didn't fill this out unless you know American Sign Language or something. If you speak other languages, I mean, like, there are people that might have that information and they need to stop and make sure they click this because it would make a difference in their practice.
By appointment. I see patients by appointment at least one day per week on a regular basis.
Yeah, but it's not at
that.
Right. Mm-hmm.
Like a virtual.
And this is, you are the provider, so it's your start date with this company, whenever your DONA certification was done. So is this your primary practice? Yes. Health educator. Yeah.
I'm not going to do subspecialty.
Yes, you will. You don't have to fill that out because it's not required, but yes, you'll continue to practice. You don't have any limitations. You accept new patients and not Medicare. We're not doing Medicare.
Telehealth.
I did not mark telehealth. I didn't do that just because I'm not sure about how to do that through the HIPAA regulations.
What did you do under the payment and remittance?
I didn't do that, and I didn't accept workers' compensation.
The office manager and payee contact.
Yes, are the same. So this is the multiple
Should I-
personalities. You are everything.
Should I fill this out up here?
You can do your business. Billing department is just billing. There, I mean, it can be you, and then check payable to either your LLC or yourself personally. You don't have a partner or associate. You don't have anybody covering you. You do, so click both of those. The office manager is also the credentialing those two boxes, click both of those boxes. And scroll down. You can put a mailing address in right there, yep. It can be sent to the practice location address. I put 24/7 because we do. I don't have an answering service or back office though, so you can just keep going down. Your Medicaid
Right.
number is that location ID for state Medicaid.
Okay, so please, what does this mean?
View it. There's a little I on, yep. Look at provider at the location. There's an exclamation point at the top in the middle and services and resources. So let's go back and see what they say. See if that drop down will work.
It's that, yeah. So, okay, but this had a lot more options here.
I just clicked the top one because you see clients on a regular basis. Click the services and resources tab at the top and see if there's anything under there that's, so
There.
add yourself. Yep, you're everything.
So office
Yep,
manager.
business staff
Okay.
contact, you're everything. Go to, keep going down on the left, go to hospital affiliations and see if that, because your practice locations is checking green. Okay, hospital affiliations, you can just scroll down this because we don't have, we're not doctors. We don't have that same thing, just save and continue. Credentialing contacts. I use the Nevada Certification Board and Natalie Powell.
Because we all had to go through the Nevada Certification Board, what is her contact information?
Her first name is Natalie, her last name is Powell. And I put that the street is just University of Nevada, Reno. And then I put nothing else is required. I just put her email address. And that is N like Nancy Powell, Powell at CASAT, CASAT.org. I put her as my primary credentialing contact. I saved and continued. Okay, if you have liability insurance, and some of us do, some of us decided to get it, it's not a requirement, but if you have it, you can upload the information here. If you don't have professional liability insurance, you just have to click the box. That's it, just click no. Employment information, it's the past 10 years. I put in April 2016 to now is my current employment. I put in me, I work for me at my address. And it's my current employer. I put in my start date. If you don't go back far enough on this, they want 10 years. I would put in all your information as a doula, how long you've worked as a doula, save and continue and see, because most people are new doulas. It really wants you to add gap records. This is when you started staying home to when you got your DONA certification.
Parental leave.
Yep, parental leave, click that, continue. Save and continue. Professional references. These are references, like I can be a reference for anyone. So here I am on video saying, you can put in other doulas, you can put in other people that know you, but you just have to have their name, last name. And I didn't do addresses. I just did phone number or I just did email. Jen Campbell, my email address is Jen, JENN at MOMOF18.com, mom of18.com. This is your like legal information. This is felonies, lawsuits, anything like that. So you should be answering no unless you've been convicted of something, and then you'd have to supply that information. Save and continue. And now it should not let you authorize until you go back and fill out the educational. You can try it. Yes, release my data. I hereby go ahead and save. Continue to attestation. You have to review and attest. So look here on the left, you can see everything and where they want. They want something different with your practice location, and they want you to add all of your certification. Once you do that, you attest, and this is done.